Hello, and welcome to the Regional Health Report. I'm Ann Krebs. This monthly program highlights the world-class health care provided at each of our Regional Health Command Atlantic medical facilities, dental clinics, and public health units to soldiers, their families, retirees, and other beneficiaries. Zika is a mosquito-borne illness that can infect anyone living or traveling in areas where the virus is found. It is possible for an infected mother to pass the virus to her fetus, which can cause birth defects. Public Health Command Atlantic, a subordinate command of Regional Health Command Atlantic, is helping to stop the spread through testing and training.
Vector-borne diseases have had such an impact on readiness, many times impacting troop strength more than bombs and bullets. The Zika mission kind of evolved from the West Nile. West Nile really taught us a lot about how to monitor for mosquitoes.
Normally our testing begins during the summer period, so we'll start actually testing around the late April, early May timeframe.
We put a big push on training in the last couple months, and we've been actively training preventive medicine collaborators across the eastern part of the country. So roughly, I would say over 100 people have received our specialized training. We teach our collaborators what traps to use and how to handle the trap catches so that they can be tested.
Here is our light trap, and so basically what we're looking at right now is to see what we've caught. We have 5 different traps that we do. Once the mosquitoes are captured, we take them back to our labs. We basically identify them and then we ship them out.
And we open the boxes here, we pull out the little tubes, we do some spot checking on the IDs, and they go right into the process to analyze for the genetic material of a pathogen if it is in it. The DoD and our program is one of a network of surveillance activities, including state and municipal health departments, that are doing pretty much the same thing. We never lose sight of the fact that we're doing this to protect the health of our constituents, which is the military community.
The Centers for Disease Control say the best way to prevent infection is to avoid mosquito bites. That means using insect repellent, long-sleeve shirts and pants, staying in air-conditioned spaces as much as possible, and removing standing water around your home. Access to health care is an important issue for the nation and for the Army. Regional Health Command Atlantic is using technology to deliver health care support over long distances. Jerome Banks reports.
I'm a 68 Whiskey Combat Medic. We will be teaching you about TC3 and the MARCH acronym, okay?
Reserve Officer Training Corps cadets participating in leadership training at Fort Knox, Kentucky, face long hours in the field to prove they have what it takes to be Army officers. Fortunately, they are not alone. Thanks to virtual technology, a team of behavioral health professionals, hundreds of miles away at Fort Gordon, Georgia, are available to listen, help them cope, and identify medical emergencies.
They have an opportunity that we're looking at everything to make sure that they're ready to train.
Using behavioral health to support cadet summer training is a first at Fort Knox. From her Fort Gordon office, Dr. Nettie Aldrich interviews cadets and staff by video. The difference between the traditional face-to-face encounter and the virtual appointment has no effect on the interaction between patient and doctor.
I usually ask them if they've ever done anything like this before, and they'll tell me they've Skyped, they've FaceTimed. They're really into it. They don't have a problem with it.
Virtual behavioral health is one of the ways Army medicine improves access to care.
I just think that the use of virtual behavioral health and virtual health in general is a really good thing. Kind of put it into tactical terms, it makes our ability to bring the right provider to the right patient at the right time.
For the Regional Health Report, I'm Jerome Banks.
The virtual health team based at Fort Gordon supports more than 500,000 beneficiaries in 26 states. Finally, Army veterinarians are also part of Public Health Command Atlantic. Their missions range from military working dogs health care to food inspection, but the most visible part of their job is pet care. We accompanied an Army vet to the Marine Corps Base-Quantico Youth Center, where she taught kids how to care for animals.
My name's Captain Beavis, and I'm the veterinarian here on Quantico. So I take care of the working dogs, I take care of your pets, and then I take care of the food. I think it's a great chance to educate the kids on things that can be really helpful for them, like how not to get bitten by a strange dog. Just remember, if a big strange dog runs up to you, be a tree. Okay? I'm always surprised at sometimes how much they seem to know and how interested they are. So what do you call this?
Elbow.
It's the elbow. Good job. I've brought with me lots of hands-on type things. So I've got 2 dog and cat models. So you're going to learn a little bit about what's on the inside of the cat. Can somebody raise their hand and tell me what this is?
Stethoscope.
The kids are so excited to hear their heartbeats with the stethoscope. That's one of their favorite parts, I think, of the whole thing. Isn't that cool? So I hope that they take home with them just a desire to treat the animals that they encounter well and to keep them healthy. I think a lot of the health problems that I see in animals that come into my clinic can be resolved with just basic education.
That's the Regional Health Report for September. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, Pinterest, and YouTube. Thanks for joining us.